All right, Learning Plan 2, Part B. As I said before, this is a longish learning plan, and I want to make sure I cover all the information that's really important. The following concepts are really important. These are referring to task and relationship behaviors. There's high task and low task, high relationship and low relationship. They fall into 4 categories. Participate, or participating, delegating, selling, and telling. Those are four management styles, 4 leadership styles that will vary depending upon the situation that is going on and the people being managed or led. Task behaviors are specific. So, very plan-oriented, very linear. Standards are there. The expectations are very clear. Let's think about clinicals for you. Very task behavior. Those clinical grids that LTC uses, I'm not sure what other colleges use, but they're very task oriented. Do you wash your hands every time you enter and leave a room? That's a task behavior. Do you complete your documentation on time using SBAR communication? Task oriented. Do you have your uniform on, complete, on time, organized? Task behaviors. So working with students, it's a very high task behavior relationship. Now, there's relationship behaviors too, and that's the opposite. These are more subjective. It's working with people side by side. So in a clinical situation, a high relationship behavior would be the instructor going with you to start an IV. The instructor is not doing it for you. The instructor is not telling you what to do step by step. The instructor is there to be your guide, your mentor, we're also there to be the person that makes you nervous, right? But high relationship behaviors involve these soft skills of listening to people, communicating, networking. The combination of the task and relationship are what falls into these 4 categories here. So and everybody can be all of these at any given time. It very much depends on the situation. When I'm grading a paper, when I'm grading a test, that's one type of behavior. When I'm working with a student one-on-one, discussing improvement plans, that's very different. So let's talk about these 4 very important styles that you really need to understand. Participatory. Low task. High relationship. So when you're participatory, it's low task, high relationship. Think about it. When your manager is participating in your work, when the manager steps in and says, hey, I'll help you out, they're not telling you what to do. They are working alongside of you. They are part of the team. So participatory leadership, low task, high relationship. Delegating is low T, low R. So when your manager comes into the unit to delegate, again, low task, they're not standing over you saying, do this, now do this, now do this. They're saying, take care of the patient in room 4. They're also not with you. They're not working alongside you. They're not being your backstop, your resource, your mentor. They're saying, go take care of the person. And then they walk away. That's delegating. So participate, low task. Again, they're not telling you step by step what to do, but they are working alongside of you. Delegating, low task, low relationship. Let's go to the opposite extreme. Selling. High task, high relationship. Have any of you ever been a salesman? I have, as I mentioned in my intro, which I hope you've watched. Excuse me. Selling, high task, high relationship. Selling something involves triggering that person's why. It can be very hard to sell somebody something, especially if they don't want to be sold. When I was selling vacuum cleaners, man, I tell you what, that took a lot of task and relationship. What do you mean by task? When you're selling something, you are showing people step by step what's important and why they need what you're selling. In the classroom, I am selling all the time, trying to get students to understand why this information is critical for your success. So I'm selling you. High task. High relationship. Think of a salesperson again. Do they just say, you need this? No. They're like, you need this because it's going to make you feel good, because it's going to make you look good, because it's going to get you, if you're buying a car, it's going to get you to your school in style, right? It's going to make you the envy of your neighbors when you come home in that phenomenal new whatever you want to drive. Selling, high task, high relationship. Many people are very uncomfortable here. It is not for everyone. Anybody who's been a salesperson knows that not everybody can do it. It certainly looks easy, but when you're truly selling, now by selling, I'm not saying you worked at for example, let's say you worked at a Walmart, stocking shelves, working at the checkout. You're not selling. You are checking out. You are stocking. You might be pointing people in the direction of where it is, but you're not there convincing them to buy that one product. Even if you're the sampler giving out samples, you're not selling anything. No, I'm talking by selling, I'm talking about you knock on the door and you're cold calling people, or you're people coming up to you to buy a car, or you're selling insurance, or you're anywhere selling. And selling is when you have to convince people to take action. That's selling. Very challenging. What's telling? Well, we've covered low task, high relationship, low task, low relationship, high task, high relationship. So what's left? High T, low R. High task, low relationship. Telling. Let's think of an example of telling. Pretty simple. So let's say you're in the skills lab, you're learning a new skill, and the instructor is standing over you saying, okay, now you open the IV start kit. Now you put the tourniquet on the arm and you palpate for a vein. Now you cleanse the area. High task. I'm telling people step by step what to do. There's no relationship there. We're not working together. I'm not there to be your backstop, to be your resource, to be your mentor. I'm there to tell you exactly what to do. Telling. So let's cover this one more time. I want to make sure you understand this very carefully. Participatory leadership, low task, high relationship, teamwork. Delegatory leadership, low task, low relationship. Again, person just says, take care of it. The assumption is you will do things appropriately. Selling, high task, high relationship. to where you're convincing somebody that they need to do, that you're convincing them that they need to take action, a specific plan. It's very hard to do that. And telling can be the easiest thing there is. It really is. Those of you who are parents and you want your child to clean their room, what are you doing here? You might think you're selling, but really you're telling. Because if you were selling, you'd be sitting with them, convincing them why it's important that they clean their room. How a clean room will make them happier when they wake up in the morning. A clean room will make their friends jealous of how beautiful their room is. And you're not doing that. You're not participating, because then you'd be cleaning the room with them. You might think you're delegating, but really, you're not delegating, because if you're delegating, you would delegate. Let's say you have Tommy who has a messy room. Delegating would be going to Susie to say, go clean Tommy's room. Okay? You're telling. You're telling your child what needs to be done, exactly what needs to be done, and that's it. Does that all make sense? This is Hertzberg's motivational factors applied to high task versus relationship behaviors. Which do you suppose will prevent dissatisfaction? Which type of leadership prevents dissatisfaction? High task, low relationship. Low task, low relationship. Key there is relationship. Low relationship will prevent dissatisfaction. High relationships will promote satisfaction and engagement. When your manager is working with you, when the manager has convinced you why it's important to do something, now you're buying into it. So, prevents dissatisfaction, promotes satisfaction. These are the most difficult. These are the easiest. Participatory leadership, pretty simple. You just jump in and help out. It's great, it's easy. Telling, very easy to do. Delegating, when you delegate, you have to be confident that the person you're delegating to knows their job. Selling, we've already talked about how hard that is. So let's talk about delegating. Because as nurses, you will delegate frequently. When do you delegate? And what does delegate actually mean? The definition of delegation is transferring to a competent individual the authority to perform a selected nursing task in a selected situation. The nurse retains the accountability for the delegation. Let's do that one more time. Transferring to a competent individual. Ooh! A competent individual, okay? The authority. So you're giving authority to perform a selected nursing task in a selected situation. That's delegation. So delegation is not pointing to somebody saying, go take care of Joe in room 4. Because if your person you're pointing to is not competent to take care of Joe, that's not delegation. For example, how many of you are familiar with ICU or the emergency department or women's health? Some of you may have taken rotations through there in your clinical experience. Some of you may work there. I don't know. But can the average nurse in a hospital walk in and be assigned to the ED, to labor and delivery, to the ICU, and just being told, all right, have at 'em, Tiger? No. They might be able to do some tasks, But can a med-surg nurse walk into the ED and immediately start taking a regular assignment? No. That would be inappropriate delegation. So when can you delegate? There's 5 rights of delegation, similar to the 5 rights of medication administration, yeah? Right? 5 rights of clinical delegation. The right task means the person is trained for what you're doing. The right person, again, the person who has the ability. The right communication. That means you are giving a specific task. Saying, go take care of Joe. It's not really good communication. It might be, but it would be better if you said, if you delegated it to the person, go give Joe a bath, or take Joe and ambulate him for 150 feet. Specifics. The right supervision and feedback. Very critical to delegation. Because remember, as the nurse, you still retain accountability for what you're delegating. So again, you're having somebody else do work that you will take responsibility for. So that means you need to supervise and provide feedback. Good job walking him, or when I went to check on Joe, he still had dirty feet. Okay, I can't think of another example. And the right circumstance. Right circumstance. So the correct situation. If a person's coding, I can't just say, go take care of Joe. That's kind of extreme. So 5 rights. Right person, the right task. With the right communication with specific details. Correct supervision and feedback, and the correct circumstance. Now, how many of you are LPNs? Go ahead, raise your hands. Of course, I can't see you guys raising your hands. I'm assuming some of you are LPNs. That's fairly common. How many of you work with LPNs? Do you know what you can delegate to an LPN? Quick story about this. This is kind of a little humorous story. When I was interviewed for this position, they told me for the interview that I needed to present a 20-minute lecture on the role of the LPN in a med-surg unit. Now, I had never worked with an LPN before, or hadn't in literally decades. So I needed to research what could an LPN actually do. Wasn't sure. Did some research, went to the Nurse Practice Act, went to the Board of Nursing, read a bunch of position papers. Turns out that there's 3 things in Wisconsin that are required that need to be in place for an LPN to do their job. 1 is they need to be trained. 2, the facility needs to, let's try that again. The facility needs to allow the task. And 3, the supervising RN needs to take authority or accountability for what the LPN does. Training, policies and procedures, and supervisory oversight. An LPN can basically do anything an RN can do with the proper training, the proper procedures, and proper supervision. Now, the funny part of that is, I made a joke in the interview when I talked about this, saying that the Board of Nursing really doesn't want to put their necks on the line and make a decision, so that's why they're leaving it up to the individual RN and the individual facility to kind of make the decisions, and because they're just not willing to commit. And the interview team just busted a gut laughing. And I knew that was a problem because it wasn't that funny. Then I had a little voice in my head, and I just said, okay, could I see a show of hands? How many of you on this interview team are actually on the Board of Nursing for Wisconsin? And one of the people raised their hand, and she goes, I'm actually the chairman of the Board of Nursing. And I'm like, should I just pack up and go home? They're like, no, we want to hear what else you have to say. Rule of thumb there is, if you're gonna insult the interviewers, have a sense of humor about it, okay? But an LPN in general is, I need to say this carefully, Because LPNs, I've worked with some LPNs who are fantastic nurses, but they're not RNs. So they generally don't get assigned the same type of patients that an RN would get assigned. For example, you look at complexity. An LPN will generally get a patient who is not as complex, who is not having orders that change frequently, who is not having frequent medication changes. You're not titrating medications. The patient will generally have a predictable course of progress. An RN will have the opposite, or can be assigned the opposite patient. Their patient could be more complex, could be changing, could be titrating medications, could need frequent interactions with the doctors for constantly changing orders. Their course may be not predictable. You will rarely see an LPN working in a critical care unit or an ED. You will frequently see an LPN working in a long-term care facility. Stable patients or residents, predictable, not a lot of changes. Of course, there are changes, but they're predictable changes. So that is how you decide what you can delegate to an LPN. Remember, with delegation comes planning, interventions, and supervision. You must supervise, because as RN, you are still accountable at the basic level of everything that is done to those underneath you. Your LPNs, your CNAs, your HUCs, whoever might be on your team, you have final responsibility. So you need to keep an eye. And I'm not saying tell or even sell to the LPNs or CNAs, but delegate and participate. Be active. Know what's going on. Follow up. Give feedback. When should you not delegate? Some major delegation red flags: when there's complex nursing activity required. When the patient is new and unknown, you don't know what that patient needs. When there's a skill involved that you don't have time to train someone else to do. Have any of you ever worked with chest tubes? Okay, so if you've not worked with chest tubes, and I have a patient with a chest tube in, and the critical care unit is busy, I don't have time to teach you how to work with chest tubes. So I won't delegate that to you. And if you don't have time to supervise, if you simply cannot supervise, you cannot delegate. Because even if you're not supervising, you're still responsible. We're going to move on to other leadership styles in the next section of this lecture. I'm trying to break these into 20-minute segments so that you don't have to watch one massive lecture, but just snippets. So we're going to come back and talk about communication, evaluation, assessment in the leadership role.